The purpose of this presentation is to share information regarding the role of the Office of Diversity and Multicultural Affairs at BUSM. Many applicants have a keen interest in the topic of diversity and inclusion, and interviewers must be prepared to provide an overview and answer questions. Let's begin by stating that from its inception, Boston University has been committed to diversity, admitting individuals from both genders, all races, all religions, and having a robust international program. The medical school is equally committed to diversity and addresses it specifically in its mission statement. Remember that Martin Luther King Jr. became Dr. King here at Boston University in 1955. But 9 decades earlier, Dr. Rebecca Lee Crumpler became the first African American woman to receive a medical degree in the United States, graduating from the medical school in 1864. The medical school has distinguished itself in the realm of diversity, also graduating the first Native American, Dr. Charles Eastman, in 1890, the first African American psychiatrist, Dr. Solomon Carter Fuller, in 1897, and Dr. Louis Sullivan, the founding dean of the Morehouse College Medical Education Program, in 1958. The Boston University School of Medicine Office of Diversity and Multicultural Affairs seeks to foster diversity and cultural competence among students, faculty, and staff. We strive to make Boston University Medical Campus as inclusive as possible. Please impress upon the applicant that our office is dedicated to unquestionable openness, promoting relations among all groups, and inspiring students and faculty to learn from each other while appreciating their differences. Many applicants ask how we define diversity. We embrace the full meaning of the term, extending beyond gender, race, and ethnicity, to also encompass age, religion, sexual orientation, culture, socioeconomic status, and many other distinguishing characteristics. Furthermore, we stress that our vision is to lead medical schools in diversity of faculty, students, staff, and trainees by developing programs to educate, recruit, and retain a multicultural constituency. We foster an environment that demonstrates our belief that diversity adds value to intellectual development, academic discourse, patient care, and research. The Office of Diversity has an Associate Dean and 5 Assistant Deans. Together, we represent a broad range of medical specialties, groups, cultures, and ethnicities, including African American, Hispanic, Muslim, LGBT affairs, and other distinguishing characteristics. Additionally, there is a medical campus-wide diversity advisory group, which includes representatives from the Latino Medical Student Association, the Student National Medical Association, the Muslim Student Organization, individuals with disabilities, and other groups. We can highlight Boston Medical Center, the most diverse and largest safety net hospital in the region, as the primary teaching affiliate of Boston University School of Medicine. Approximately 75% of Boston Medical Center's patients are ethnic minorities, the majority of which are Black and Hispanic. Spanish, French Creole, Portuguese Creole, and Arabic are commonly spoken by our patients, and many of our students speak more than one language. An example of Office of Diversity sponsored activities is what we call conversations. These periodic and highly rewarding panel discussions encourage candid dialogue among faculty, students, and staff. We discuss the history, evolution, obstacles, and accomplishments of various groups on the medical campus. These often provocative conversations provide an opportunity to enhance cultural competency and uphold the freedom of expression necessary in a university. The conversations also are lively social events, serving as an opportunity to meet individuals with similar interests. The Early Medical School Selection Program, or EMSSP, is a unique program administered by our office, which exemplifies our institution's commitment to increasing the acceptance of students from traditionally underrepresented minorities in medicine. The program was created in 1983 and is a partnership between Boston University, Boston University School of Medicine, and the institutions seen on this slide, representing a variety of historically Black institutions, schools with significant Mexican-American enrollment, and one institution with a large Native Hawaiian and Pacific Islander enrollment. The Medical Campus Arts Outreach Program is an extension of the Boston University Arts Initiative and consists of a partnership between the medical campus and the College of Fine Arts at BU. This program resides in the Office of Diversity and Multicultural Affairs and seeks to promote interdisciplinary dialogue, building productive relationships between the arts and healthcare, raising awareness and celebrating multiculturalism on the medical campus. The BUMBAN is a diverse ensemble comprised of medical students, faculty, and staff whose mission is to foster interpersonal relations on the medical campus through the enjoyment of music from every tradition. The BUMBAN has performed on the medical campus and at the Berklee College of Music to raise funds for a variety of charitable causes. The BUMBAN has been featured in local newspapers and on television and is open to all students, faculty, and staff who love and enjoy music. Lastly, many applicants ask if we address issues of disparities in healthcare and cultural competency in our curriculum and activities. The answer is yes. We have a keen interest in these important issues, and our graduating students report feeling well trained to practice in a multicultural setting. The Office of Diversity maintains a directory of faculty with diversity-related interests and serves as a resource for the entire medical campus to provide guidance and facilitate networking in the broadest range of interests related to multiculturalism and inclusion.